Right now, artificial intelligence is reading your medical data faster than you can blink. Every heartbeat recorded on your smartwatch. Every prescription filled at your pharmacy. Every test result from your last doctor's visit. All of it feeding into algorithms that know your body better than you do. But here's the question that should keep you awake at night. Is this digital doctor saving lives, or building the most intimate surveillance system ever created? This isn't some distant future we're talking about. This is happening today. The FDA has already approved nearly 950 medical devices powered by AI. Your health insurance company might already be using algorithms to decide your coverage. Hospitals are deploying AI systems that can spot cancer in X-rays with superhuman accuracy. And yet most people have no idea their most private health information is being processed by machines they'll never understand. Picture this: you walk into a hospital, and before you even speak to a doctor, an AI system has already analyzed your medical history, your genetic markers, your lifestyle data from fitness trackers, even your social media posts about health. It's cross-referencing this information against millions of other patients to predict what's wrong with you, how you'll respond to treatment, even when you might die. This isn't science fiction. This is machine learning in medicine, and it's transforming healthcare at a speed that makes your head spin. Here's how it works. These AI systems need massive amounts of data to learn. They consume electronic health records from hospitals worldwide. They analyze medical images like CT scans and MRIs, learning to spot patterns that human doctors might miss. They process genomic data, understanding how your DNA influences your health risks. They even incorporate data from wearable devices, tracking your sleep patterns, heart rate variability, and daily activity levels. The technology uses something called deep learning neural networks. Think of these as digital brains with millions of interconnected nodes, each one processing tiny pieces of information. When you feed them enough medical data, they start recognizing complex patterns. An AI system might notice that patients with a specific combination of symptoms, lab values, and genetic markers have a 94% chance of developing heart disease within 5 years. It can flag this risk before any human doctor would spot it. In radiology, AI systems are already outperforming human doctors at detecting breast cancer, lung nodules, and diabetic retinopathy. They can analyze thousands of medical images per hour, never getting tired, never having a bad day. In drug discovery, AI is identifying potential new medications in months instead of decades. In surgery, robotic systems guided by AI are performing precision operations that human hands simply cannot match. The surgical robotics market alone was valued at $4.3 billion in 2024 and is projected to hit $10 billion by 2030. These aren't just fancy tools. They're intelligent systems that can adapt to unexpected situations during operations, making split-second decisions that could mean the difference between life and death. But here's where the story takes a dark turn. Every single piece of data these AI systems consume tells a story about you. Your health records don't just contain medical facts. They reveal your deepest vulnerabilities, your genetic predispositions, your mental health struggles, your reproductive choices, your substance use history. All of this information, once digitized and fed into AI systems, becomes a permanent digital footprint of your most intimate moments. The ethical dilemma is staggering. Recent surveys show that 68% of Americans fear that AI could weaken the patient-doctor relationship, replacing human compassion with cold algorithmic decisions. More concerning, 63% cite data security risks as their biggest worry about AI in healthcare. And they should be worried. When your health data gets processed by AI, it doesn't just sit in your doctor's filing cabinet. It flows through complex networks of hospitals, insurance companies, pharmaceutical corporations, and technology giants. Consider this scenario: your AI-powered health app detects early signs of Alzheimer's disease from your speech patterns and typing behavior. This information gets shared with your insurance company, which raises your premiums. It gets sold to data brokers, who package it with thousands of other profiles. It gets accessed by potential employers during background checks. Suddenly, a technology designed to help you becomes a tool for discrimination against you. the surveillance implications are even more troubling. China is already using AI health monitoring systems to track and control populations. Imagine a future where your government can monitor your health status in real time, predicting not just your medical needs but your productivity, your compliance, your worth to society. This isn't paranoia. This is the logical extension of current trends. Research shows that over 60% of healthcare professionals hesitate to adopt AI systems due to transparency concerns and data security fears. They understand something many patients don't: once your health data enters an AI system, you lose control over it. These algorithms make decisions about your care using logic you cannot understand, based on data you cannot see, for purposes you cannot verify. The future is rushing toward us whether we're ready or not. Within the next decade, AI will likely become the primary diagnostic tool in medicine. Your doctor might become more of a health advisor, interpreting and explaining decisions made by artificial intelligence. Preventive care could become hyper-personalized, with AI systems monitoring your health constantly through embedded sensors and predicting problems before symptoms appear. Imagine AI systems that can detect depression from your voice patterns during phone calls, or cancer from the way you walk, captured by sensors in your smartphone, or cognitive decline from subtle changes in your typing speed and accuracy. This technology could save millions of lives by catching diseases in their earliest, most treatable stages. But it could also create a world where privacy becomes extinct, where your health status determines your social credit score, where insurance companies use AI predictions to deny coverage before you even get sick, where employers screen out candidates based on genetic predispositions detected by AI analysis. The regulatory landscape is struggling to keep up. The FDA is strengthening AI regulations to ensure patient safety, but the technology is evolving faster than the rules designed to govern it. European authorities are implementing strict privacy protections, but global data flows make enforcement nearly impossible. We're standing at a crossroads. Down one path lies a medical utopia where AI eliminates human suffering, where diseases are prevented before they start, where healthcare becomes truly personalized and effective. Down the other path lies a surveillance dystopia where our most intimate vulnerabilities become data points in corporate and governmental control systems. The choice isn't whether AI will transform healthcare. That transformation is already happening. The choice is whether we'll demand transparency, privacy protections, and human oversight in this process, or whether we'll sleepwalk into a future where our health becomes another commodity in the attention economy. The machines are watching. The algorithms are learning. Your data is flowing. The question isn't whether AI will revolutionize medicine. The question is whether you'll have any say in how that revolution shapes your life. Subscribe to VoidViz to decode tomorrow's tech.